Hi, everyone. This is Dr. Nicole Cozine. I am the founder of Pelvic Sanity and the co-founder of PelviCon. We have with us today Dr. Jessica Riel of Southern Pelvic Health and also co-founder of PelviCon. And we're really happy today to be able to talk with Stacy Roberts, who is a pelvic floor physical therapist who also works with a company called Shockwave, who makes the Shockwave technology unit. So Stacy, thank you so much for being on with us.
Oh, no worries. Such a pleasure to be here with you guys.
So Stacy, can you talk to me a little bit about your history? How long have you been in pelvic floor physical therapy? And how did you get introduced to Shockwave and Shockwave technology?
Absolutely. So my background is a physical therapist for over 33 years. Also a master's prepared nurse. I have my RN and my master's in nursing and going on to complete my nurse practitioner, hopefully in the next year and a half. And then basically I went into nursing to expand my scope of practice from PT point of view, because I've been working with women's health for, 20 years, and then expanding more to men's and women's pelvic health in the last decade. And really from a PT standpoint, I never really utilized modalities at all. I had pretty good results without utilizing them, and have been very, very skeptical about modalities over the years. And then a friend just said, hey, there's this machine called Shockwave. It's a Shockwave technology. Have you heard of it? And I had not, and especially not for pelvic health. And she kind of dragged me along to this consultation because, hey, you're a PT, you can let me know if this stuff really works. And I only went because she was my friend, to be honest. Otherwise, I would never have gone. And then saw what happened at the appointment. She had some residual shoulder pain at end range that was completely resolved with the treatment. And I was like, what the heck is this? Because it looks like ultrasound, sounds like electrical stim, and it's completely different from those two modalities. So dug into the research, 6 or 8 months into it, looked at all the different devices out there, and I really landed on Shockwave because it has what the best as far as best depth of penetration and biological effect, and was fantastic when we started utilizing it with pelvic health. It is able to bring blood flow to the 3 different layers of the pelvic floor like nothing I've ever seen before. So I was really intrigued, not just from a musculoskeletal joint and muscle point of view, but also pelvic health. And it's been, I built my practice, my cash practice, basically around this device. And we're doing great after almost 3 years now.
That is so cool, Stacy.
Yes, really amazing.
Yeah, and it's interesting because I will say when I first, and you and I have had conversations, Stacy, when I first heard about it too, I was very skeptical because you start hearing these different things that it does, and it almost sounds too good to be true. And I always tell people if something sounds too good to be true, it probably is. But Shockwave does some really cool stuff. Can you talk a little bit about the Shockwave technology and really what Shockwave does?
Sure. So Shockwave differentiates itself in its patented applicator. So this is the applicator here. It's called electrohydraulic technology for Shockwave technology. There's water inside here with a little electrode. And when that gives off a bit of a shock, what happens is that wave goes into the body as an acoustic wave, but it penetrates much deeper than any of the other modalities on the market. And again, what's really unique with Shockwave versus any of the other Shockwave devices is the applicator is shaped more like a flashlight. When you look at other devices, they're shaped more like a laser. So with Shockwave, it's much more comfortable for the patient. There's no microtrauma at the cellular level, which is what the other Shockwave devices tout as the reason why they work. So there's no microtrauma. It's much more comfortable for the patient. And because it's electrohydraulic, it penetrates much deeper, and the biological effect can go up to like a soup can length or 4 to 6 inches, which is perfect for pelvic floor, especially the upregulated pelvic floor that we can't get to relax no matter what we do with the patients. It significantly helps on the first treatment, which again blows me away because, I've always had good results with pelvic floor therapy, but it can take 8, 12, 20 visits sometimes, where these patients are being having their dyspareunia, vulvodynia, vestibular dynia, trigger points in the pelvic floor resolved in 3 or 4 visits, with this and utilizing physical therapy.
That's actually pretty amazing. And then, so forgive me since I am not familiar with the technology. So, and you're using this like transperineally? Is that
Yep, put it right on the perineum. Yeah,
Okay.
typically, but also let's say we think there may be some neurogenic pain, right? So ischial tuberosity pain,
Cool.
that's kind of diffuse, things like that. So we trace then the pudendal nerve. And if we find a hot spot along the pudendal nerve that then creates that same sensation, then we know that we're hitting the right spot to treat. And what's really cool with this is I would never be able to palpate that pudendal nerve at the depth that this is getting to recreate those symptoms. So it's kind of a biofeedback device and a little bit diagnostic in a sense as well, because it kind of tells you where also you need to treat or where to focus. It's really an extension of what we do as physical therapists, not meant to replace what we do, but really an extension of what we do, and enhances our manual therapy significantly.
And, Stacy, you and I have spoken a lot about some of the different types of, and I'm going to say in quotes, shockwave that's out there. And it's interesting because if I were to just Google like shockwave device, like I could probably find some like really cheap option out there for something that claims to be shockwave, and which is very different from what Softwave is offering. Can you explain a little bit, and I know you spoke on this a smidge, but just kind of the difference between what Softwave does versus what might be some of the other things that people see that are claiming to be shockwave.
Absolutely. One of the most common ones, especially when we're looking at men's health and ED in particular, is the radial shockwave device. Well, radial technology, radial wave devices are not actually true shockwave, but they, for whatever reason, I don't know, 10, 15 years ago when this all kind of came on the scene, they're kind of lumped under shockwave technology. But truly, they don't give off an actual shockwave. Basically, they're like a jackhammer, which is smashing against the tissues to create that microtrauma, or we could really argue macro trauma effect, to get the inflammation restarted and then move it from pro-inflammatory, anti-inflammatory, et cetera. But patients will walk out from musculoskeletal point of view, plantar fasciitis, epicondylitis, Achilles tendonitis. It can be effective for those superficial issues, but they literally walk out, and therapists, if they have a radial device, will tell them this is going to really hurt you for the next 2 weeks, significant amount of pain, but then you're going to feel great. So just stick with it for the 2 or 3 weeks. Now, when I heard that and I was, looking at different devices, I thought, how am I going to tell that to somebody with pelvic floor issues, right? Vulvodynia, painful injury. I mean, that's not a conversation I want to have. So there's a lot of confusion in comparing a radial device to something like Softwave, where Softwave, again, has none of that. They're feeling better when they walk out. Again, the depth of penetration is not, a few millimeters. It's up to 4 to 6 inches. It covers a large surface area. None of the other true shockwave devices even cover the surface area that Softwave can cover with the comfort that Softwave has. And the impact of the electrohydraulic impact, again, is fantastic with the pelvic floor, relaxing it and bringing blood flow to the area. So the two primary mechanisms of action is increasing blood flow to the area almost instantaneously, but also modulating inflammation. Those are the two significant mechanisms of actions that really make a huge difference.
That's really wonderful and interesting. And I can sort of see now how some of those orthopedic musculoskeletal things that were potentially more acute in like an orthopedic physical therapy place, that might make a little bit more sense and stuff like that. But in somebody that has a chronic pelvic pain issue with an upregulated nervous system, brain changes from the amount of pain that they've been in, I love that you're making that distinction there and helping us to understand that. So thanks so much for that, because I think that that's a really important piece for us to understand as practitioners. Yeah.
Huge. And even in the research, when you read a research article, it will say, extracorporeal shockwave, ESWT, all the different terms, but you really have to look at the device because the outcomes are extremely different. That's another reason why insurance isn't covering it, because, they aren't going to cover anything that has inconsistent results. Well, if they're comparing it to a radial device that has poorer results, but they're calling that shockwave and then comparing it to another shockwave device, it's just very confusing. So I do love education for therapists in regards to how to distinguish this, because which one is right for my particular practice.
Right. Awesome. And then, so let's kind of go a little bit with that. So we talked a little bit about who it's appropriate for in terms of patient care. Now, if a pelvic floor therapist is sitting here right now being like, "Ooh, interesting. What are the steps in getting this potentially into the clinic, trialing it? research stuff,
Mhm.
who do they contact? What's happening? How can we get in touch with this thing? Quite
Absolutely.
literally, actually.
Absolutely. So there's an option to talk to Softwave directly for sure. But what I recommend, because we're getting this out to PTs and pelvic health therapists, and they are not, right? They don't have the background in regards to pelvic health. And that's why they rely on me to go train the physical therapists or gynecologists or MDs, whoever is looking at adding this to their practice to support their pelvic health patients, because I have the clinical knowledge, and there really is only a handful of us right now around the country utilizing the Shockwave device for pelvic health. We've put together a research study with 4 PTs around the country. You know, Jessica and I are involved in a research study for incontinence coming up soon with this device as well too. So it's all very exciting. So I would recommend that they reach out to me at, we'll be able to provide some contact details, or do you want me to give that now, or?
Yeah, contact you. I mean, is it just say it right now on there, and then we can make sure that
Sure,
that
if they
gets
just
disseminated.
Sure. So Stacy, Staceyr at newyouhealthandwellness.com. They can reach out to me in the email, and then I can put them in touch with the company, but also do the demos and training as well if they need that too, and talk about the research, because it's really important to, obviously, as you know, to speak to a clinician that's using the device in order to help understand it, versus just speaking to a salesperson that is just really trying to sell them that device.
Right. Totally.
Yeah. And, Stacey, you mentioned some of the research that's underway. And I think that is one of the unique things too about Softwave, in my opinion, is their commitment to promoting more of a multi-modality type approach when it comes to working with people with pelvic health conditions. And so I think it's super cool that they are invested in studying not just is Softwave effective for these problems, but what does it actually look when we pair Softwave with pelvic rehab? Can you talk a little bit more about the research that is ongoing currently, and like what's planned in the future, and where is that passion with Softwave and with you for this?
Right. Yeah, I'm really excited about the research aspect of it, because it is a huge passion of mine to get this out to as many people as possible. And for me, as I know for you guys, if there isn't research on it, we're kind of like, does it really work, right? So it brings validation to it, and Softwave is committed to doing that research and partnering. But they also have, even started from the ED and men's health, is Dr. Irwin Goldstein at San Diego Sexual Medicine is doing a significant amount of research on not only ED, but Peyronie's and PGAD and vestibular dynia as well. Then we have Dr. Andrew Goldstein on the East Coast doing vulvodynia study for vulvodynia with Softwave, not with PT or without PT, but just on its own treatment. And then we have a study that's going on, which is for PTs around the country, myself, and in Seattle and LA, and also over in New Jersey, New York. That's a dyspareunia study. And then Softwave is helping to support that. And then also with our study with Jessica and Dr. Rachel Rubin, we're looking at stress incontinence as well too. So we just want to get as much information out there that's valid, that's supported, that's gone through the IRB process, and to educate people just about Shockwave in general, but specifically have them look at the Softwave device because of the differentiator that it is in the market for their clinic, but also how it differentiates itself from the other Shockwave devices out there.
Yeah, that is really interesting. And what I'm really excited about as well is for people that are going to be in person at PelviCon. Stacey, you are going to be able to be there with them. So can you talk to me a little bit about what made you excited to come to PelviCon and share this technology?
Absolutely. Before I get to that, I just wanted to mention too, another physician that I remembered is Dr. Peters up in Michigan, who's doing pelvic health. He also, I just trained his staff as well with Softwave. So he's very excited and just wants to get another device as well, because he's also looking at doing research as well too.
Cool.
Really
to
wonderful.
answer your question, Yeah, absolutely. To answer your question in regards to PelviCon, I am so excited to be there because, I mean, these are our people, right? So these are all wonderful pelvic health therapists that really want to do the best for their patients, but also everybody's looking for a way to differentiate themselves, right? And a way for them to give their patients what their patients deserve, but also what their patients need, and also then grow their business. Because if we have a business for ourselves, we also have to, pay ourselves, right? That's always a good thing. So this is a great differentiator to get people in the doors for them as well too. And also if they're interested in the research aspect, we kind of have an open book as far as, what we can plan in regards to research projects related to pelvic health, where there really is none in this, realm with Shockwave, and specifically with Softwave as well, especially the electrohydraulic Softwave device. So I'm really excited to meet everybody at PelviCon to display Softwave, but also to learn amongst, like individuals in regards to just pelvic health topics anyway, but also to hopefully introduce something new and exciting to pelvic health therapists that they may not have known about before.
That's awesome. That's awesome. And you'll be bringing the Softwave device to PelviCon. And so if people are coming in person, they'll even have a chance to feel it and experience it. Because I do think, like you said, we all make the assumption when you first look at the device of what it's going to feel like, which is typically based on our experience with other modalities and stuff, but it is its own unique thing. And so that'll be a really great opportunity that people will have Saturday afternoon.
Yeah, absolutely. And thank you so much for that opportunity. I'm really excited.
Yeah, wonderful. Well, Stacey, do you want to leave with any parting words about the technology that you haven't said? Anything that you want to tell all the pelvic rehab providers out there about the technology?
Absolutely. If you're skeptical, I think that's excellent, because I was completely skeptical. And I'm even still surprised at how well it works sometimes with my patients. So please come by and ask me any questions, anything I can do for you from a standpoint of research. We can talk about how we can get a demo or potentially get into your clinic so you can trial it on patients. It's just really something you have to feel and have to, kind of wrap your hands around in order to really experience the value in it. And then thinking about that, I can help work with you on how you can implement it into the clinic, whether you're a cash pay business or whether it's a hybrid that wants to increase their, cash base as well too. So yeah, I'm really excited about the opportunity to be there.
Well, wonderful. Well, we want to just say thank you so much on behalf of PelviCon that you're a platinum sponsor of the event. We really appreciate all of your support and all the things that you're doing in order to enhance what we do for patients. So thank you so much.
No problem. Thanks you guys for doing this.
Bye. Thanks so much, Stacey.